Hi, Dr. Hans Christofferson here. We're going to do a tour of Animal Care Clinic prior to our reno. So come join me on this beautiful sunny day and let's head inside. So here we are inside the front door in reception. If we walk over here, here is our reception desk where our customer service people will help you out. And then over here we have our retail area, food shelves, TV behind me. You can see the food shelves are empty because we're preparing for the reno. And one of the things we're really hoping to get rid of is this echo. Yeah, when dogs bark, ooh, that's not fun. So then we'll come into here. Here is one of our exam rooms. Try not to hit the wall here. We currently have two, and they both look pretty much the same. Over here, have an exam table, computer, and then we continue out of the exam room and we end up in the pharmacy area here. There's a hallway behind and we come along here. Here is our pharmacy. As we continue through here, there is our second exam room. One of the big problems we have is with the amount of vets and the amount of appointments we see, only having 2 exam rooms, it's not quite enough. We really need more. With the reno, we're going to expand to 6 exam rooms. I'm really excited about that. It'll do a couple of things. It will really help us to serve you better by allowing us to do more appointments, and it'll also help keep our clients safer because we'll no longer have people congregating in the reception area, especially in these times of COVID and even post-COVID. I think that's a really good idea. So let's go into treatment here. So this is the treatment room. This is where we tend to take care of animals. We have a small lab area right over here. You can see the microscope and the sink. And then if we turn around this way, we have the exam tables that we work on animals on, and there goes the phone. They do ring all the time, even when we're closed like we are now. And then through here, we come into our surgical area. This is behind closed doors, and it is a sterile area. So you can see over here, we have the anesthetic machine, and there is a surgical table. Over right there, that is our surgical monitor that monitors all the parameters of your pet when we're doing surgery. And then we have a nice 2-way door here we can back out of. Now, the last thing I will show you in this area is our x-ray. And if we come through here, you can see this is our x-ray room. We have a fully digital x-ray setup. So that is the head there. We have the x-ray table there, and then the computer that we read all the images on. And finally, this here is our old dark room. This is where we used to have to develop the x-rays, but now that we're digital, we don't have to do that. So in fact, we have a nice suite of lab equipment back here, if I can get it in the shot. There we are. So this is our full set of in-house lab equipment. These 2 machines on the edge, there and there, these are blood analyzers. And this one in the middle is a urine analysis machine. This is really cool because it means we can get results for your pet really quick in the clinic. If we need to take a little more time, it's no problem. We can also send that out to the lab, get a few other tests done, but it's really nice to have these facilities in-house. And finally, back here, we have a dental x-ray suite. Under here, there is a digital dental x-ray processor, which is also a really nice thing to have. Next, we'll go and see reception. So here we are starting in our current reception area. This will be moved with the reno along with the treatment room. So what you're seeing now won't be here for too much longer, along with the other things I'm going to show you. So we're going to head this way. There is our bathroom, that's staying put. We go through a hall here, and we do have a third treatment room. I did kind of lie, we have an extra, but the problem is this one's out of the way, so we're pretty much using it for telemedicine consultations right now. And then in this area, we have the current staff kitchen, and the door there connects back into the pharmacy area that I showed you earlier. And now, just for fun, we're going to move into the old part of the clinic. Okay, so now we're going back into the old area of the clinic. And be prepared for a time warp. This is the old building. We are going back to the 1950s. You ready? Let's go. So as I said, this is the old building here. The building we were just in was renovated somewhere around 2006. This building, we believe, was built somewhere in the 50s, and this is the old cinder block buildings that we had back then, including, bizarrely, a cinder block ceiling. I've never seen anything like this, but hey, when the bombs start falling, this might be a really good place to be. Haha. Okay, let's continue with the tour. In here, we have our doctor's office. This is getting moved out to the kitchen area that we saw previously, and the third exam room is also getting converted into more offices so the doctors can be nice and close to the action. Down here, that thing on the wall is not a big spider. It is an internet router because, of course, there was no internet when this was built. We have our grooming room in here. This is where our groomer takes care of all your pets. And then down this way, wards, endless wards. Let me show you over here. This is the board for all of our cages. We have a ton of old cages because back in the 50s, vets were also boarding facilities and they boarded a lot of animals. We don't tend to do much boarding nowadays, so this space down here we don't use for a whole lot. Now we're going to go into the old reception area. Back in the day, this clinic was reversed from what it is now, and this is the old reception area. I warn you, it is a mess. But what can we do? We're about to start renos, and it's a good place to store stuff, let's be honest. So here we are back here, lovely green hospital style walls. We have some storage over here, and then the coup de grace, the old reception desk. Isn't it beautiful? That thing is probably also from the 1950s, and this is the last time you'll ever see it because it's going bye-bye with the reno. And now to end the tour, we'll head back out into the parking lot. We'll go through the other door. This is our staff door here. And here we are, back out in the sunshine and the noise of the traffic. Thank you so much for joining me today. I very much appreciate it. And we hope we'll see you soon at Animal Care Clinic. Thanks so much. Thanks for watching. Hope to see you here again. If you liked this video, please do subscribe. For more information, please visit animalcareclinics.ca or give us a call to book an appointment, 833-4MY-VETS. See you next time.